I'm Justin Brady, and it is that season. It's the season of allergies and sniffles, and you may have that lingering cough that just won't go away. Is that a concern or not? I actually don't know. I'm not an expert, so we brought one in. Elli Vore, a physician assistant of Hy-Vee Health Exemplar Care, and of course, a really cherished collaborator of ours here at iowapodcast.com. Thanks for coming in and breaking this all down.
Yeah, thanks for having me.
Do you see the high influx then of tons of people coming in for allergies right now? Is this really a thing, or is it just in my head?
No, it really is. Here in Iowa, we have all the fluctuations of weather, especially in the springtime. So we're really seeing allergies start happening a little bit sooner than most people would expect. It's definitely a thing. So the sniffles, itchy eyes, watery eyes, sneezing, that's a real thing. Those are allergies.
You said earlier? It's earlier this? Why would it be earlier this year?
Well, not necessarily earlier. It just may seem like that just because we've had those fluctuations in weather where it's really nice for a day and a half and then it gets cold and rainy again. So when all of those things, the grass and the pollens and the trees are starting to bloom a little bit, even that can just trigger some allergies for people.
In my experience, it seems to be like a two-stage kind of thing.
Yeah.
Immune system is bad, but then also environmental things are happening, and then boom, I get hit. So what are the external things that are affecting allergies? Is it just pollen? Is it agriculture? What is it?
All of the above. When you have allergies, everyone can be allergic to different things. Trees, hay fever, that's more in the fall with harvest time. Grass, there's different types of pollen that people can be allergic to. So that's why some people have allergies in the spring versus summer versus fall. Just depends on what you are allergic to. A lot of people will never really know because no one is an expert on the pollens that are going around. But it tends to be around the same seasons that people will have allergies every year.
So this is why it's kind of a moving target, and it's hard for people to know because it seems random, right? Your allergies just go crazy and there's no apparent reason.
Yeah.
This is why, because it could have been something, it could have been something in the environment. It could have been a combination of factors.
Yeah.
This is the problem.
Yeah, and especially here in the Midwest when we get a lot of those windy days, that wind is going to blow pollen around. That's why you're going to have allergies. A lot of people will see that their allergies are better after it's rained. That's very classic for allergies, yeah.
Because it wets all the dust down and things aren't stirring?
Yep.
Does it have anything to do with like the moisture in the air is like helpful for the sinuses or something?
I'm sure there probably is some scientific reason for that. Yeah, I'm sure. But yeah, it just seems that rain tends to calm things down a little bit.
If it's a slight thing, I'm assuming we don't go into the doctor every single time. But if it's getting in the way of your work or it's starting to bother you a little bit, what are the treatments that you're normally recommending to people?
Yeah, so just the basics, over-the-counter antihistamines, Claritin, Zyrtec, Allegra, Zysol, they all come in generics too, so they're relatively cheap. That's a really good place to start. Also like Flonase or Nasacort, any of those allergy nasal sprays are super helpful, more so with like congestion, clearing out your sinuses, helping with the inflammation. A lot of people with allergies will have like ear issues where you feel like your ears are full or you can't get them to pop. The Flonase and nasal sprays will help with that. So those are the two big ones. Then there's other, prescription antihistamines. There is sometimes steroids can be helpful. Then you really get down the path and people will do allergy shots. But that's when things get super severe. But for an average person, the antihistamines that are just over the counter can be very helpful.
Now, what about the non-pharma stuff? What is the more like non-pharma treatment option for patients that come to you and they're like, I don't want to get on a drug right now.
So, a lot of times I'll recommend even just like nasal saline rinses. So just salt water is what it is. And that helps clear out your sinuses, can help with that drainage that we get with allergies. And then even some people will have benefits with just trying to focus on lower inflammation diets. So, and that's going to be helpful for more than just allergies, joint pain and mental health and things like that. But just lower inflammation can help with allergies for sure.
I can actually attest to that because as I told you before we recorded, I had seasonal allergies that have been extremely severe my entire life. And not until I changed my diet and I started using saline. I don't know the science behind it, but it like eats mucus essentially and it hydrates the pathways and it opens things up.
Yeah.
And so not until I learned this stuff was it actually helpful? And like what you mentioned is lowering inflammation.
Mm-hmm.
I've noticed that like lowering sugar for me, just for me,
Yeah.
switching to organic food has
Mm-hmm.
helped me a lot. It's just a me thing.
Right.
But yeah, you're right. The overall inflammation. What are some tips that people can like? How do people lower inflammation? Because that seems like a Rubik's Cube issue.
Yeah, and it is going to be different for a lot of people. Everyone's body is just different. So, like you said, sometimes eating more organically can help lower inflammation. Trying to stay away from those processed foods.
Mm-hmm.
My nice little sugary Starbucks, trying to avoid those. I mean, in moderation,
We'll
it's
just
okay.
Ignore that.
We'll ignore it. Yeah,
Ignore it.
in
It's not
moderation,
there.
it's okay. But just processed foods and high salt foods and they don't really understand what that is doing to your body.
I'm pretty strict with my diet, but sometimes I'll have a dessert. You
Right.
know, sometimes I'll have a piece of candy or something.
Right. And that's okay. I mean, you got to live your life too. So
yeah, that's what the immune system's
yeah.
for. I have heard, and I actually don't know this is true, but we've tried like bee propolis and stuff because like and raw, unfiltered organic honey, regional.
Mm-hmm.
Is this stuff still advisable?
Yeah,
like local honey from your environment?
That's a real thing. And I don't know if I could, give you the scientific reasoning to it, but it can help. Just using, even when people travel, I've heard that, they'll get local honey. If their allergies are flared up, they'll take a spoonful of that and allergies can get better. Just because you're introducing your body to the natural pollens of the location that you're at that time.
It's crazy stuff.
Yeah.
What are the differences then? Some people think they have an allergy and they have a cold.
Mm-hmm.
Some people think they have a cold and they have an allergy.
Mm-hmm.
I don't know which one I'm dealing with.
Yeah.
And so is it important to know, or how do I know the difference?
So the big things that kind of determine, is this allergies versus cold? If you're itchy, that's going to be more allergies. Itchy eyes, itchy ears, itchy nose, itchy throat, sneezing, watery eyes. A lot of times that is allergy related. More so colds, you're going to have, the classic sore throat, runny nose, congestion. I mean, all of these, there are overlapping symptoms of allergies, which can make it difficult for people to know. A lot of times colds obviously will last that typical 7 to 14 days. Allergies are going to last much longer than that typically because it's seasonal.
So it's basically sneeze and itch.
Yeah.
You probably are probably dealing with allergies. No sneeze and itch, it's probably a cold.
Probably. And like with kids too, a big sign, kids will have like these dark bags under their eyes. Oh. We call those allergic shiners, or there's a word for that. They're called allergic shiners. That's a thing. So the dark bags and then are like a crease on their nose. They're constantly going like this. It's going to cause a crease. And those are two big actual, signs of allergies in kids. And so it's hard to tell with kids if it's allergies versus colds.
And again, what are the pharma and the non-pharma treatment options? Mm-hmm. So people who are like, I want to do this naturally. I don't want to do drugs. What are the options here?
Yeah, I mean, again, over the counter, decongestants, Dayquil, NyQuil, Advil, cold and sinus. Like those are the big ones for pharma options. And then non-pharma, I'm a big fan of like immune support supplements. So in the winter, I have 2 little kids, so they bring home all of their germs from daycare. And so I will start for what I do for work, I just see sick people during the winter. So I'll start an immune support supplement, which is zinc, vitamin D, vitamin C.
That's genius.
So I just, I will take that kind of more so seasonally just to kind of boost my immune system to try to not get sick during the high cold and flu season. So that's one thing that I've started to recommend to people.
Can I tell you, I do the same thing.
Yeah, I think it's super helpful and it can help.
What are some of the errors that people make? Like, I've heard there are some like stories where people have allergies or cold and they kind of do self-treatment options, and maybe that's not the thing they're supposed to be doing.
I mean, people do crazy things. Like I have seen it all. I've seen people putting things in their nebulizers that are not.
What?
Oh, I've seen it all. It's not even going to go there, but there's people that will put things that should not go in nebulizers and they're inhaling that. Uh-huh. You should not be doing that. That's going to make things a lot worse in the long run. I've seen people, I mean, like ear issues. I've seen people do like the whole candle waxing. Like that's a thing that people think
I've heard of this
still
stuff.
recommended, and it is not recommended. Well, I
Oh.
don't.
Yeah,
I don't
you
recommend
don't.
it.
Yeah.
But people will read some crazy things on the internet, and they're willing to try anything to make them feel better. So
I think that people don't understand that you can get an infection from stuff.
yeah,
Like
Yeah.
your immune system, your skin, your organs, even your eyes are so good. Your ears
Mhm.
are so good at defending against the environment. They do it all day.
yeah,
But then when you do things, there are certain things you can. This could be a whole discussion, but there are
Right.
certain things you can do that may have immediate relief, but actually tear down your immune system, making you even more vulnerable.
Right.
So this is
Right.
definitely something. Go to your physician,
Mhm.
tell them what your goals are,
Yeah.
and get treatment. So.
Yeah.
Is this another thing you recommend too, by the way, is when people come to you for a cold or allergy, don't just take my word for it. Like, don't just blindly ask me, like, tell me what your goals are.
Yeah.
Like, come and say, I don't believe in any pharma at
Mhm.
all.
Mhm.
I am, I want to be completely 100% natural, or pharma's fine with me as long as it's in moderation.
Yeah.
Or just give me the drug, I want to be done. Is this something that people should probably discuss with you up front?
Yeah, I mean, I always appreciate having those conversations, because then I'm not giving my treatment recommendations to someone that's not even going to do that anyway. They don't have any
Right.
desire to do that. And I think a big part of family medicine, but also direct primary care as a whole, is really developing those relationships with your patients so that you know what their goals are. That's why, having these longer appointment times, it's a lot easier for me to talk to someone about what their goals are and how I can help them, versus traditional medicine where you're in and out in 15 minutes. You get 5 seconds with the doctor and that's it. But just having those longer appointment times, I mean, I feel like I do know my patients. I know, their parents. A lot of times I see the whole family. So I know kind of what their background is. And that makes a huge difference when patients feel like they're taking part in their care, and they, feel not in charge, but they have control over their care, and they feel like their provider is listening to them. The outcomes we see are so much better than when it's just one-sided, me telling you what you need to do.
Yeah, I think that's important because in the past, I don't know, couple decades, healthcare has kind of treated everybody like in the same boxes. You're all the same. We're going to treat you all the same. We're going to run you through like an industrial, warehouse. And people are different.
Mhm.
People have different immune systems. They grew up in different environments. They live in different environments.
Yeah.
I've been discovering within the last couple of years how bodies are very different. Like one diet that can be very healthy for one person can actually destroy someone else's gut flora. It can destroy someone else's immune system.
Mhm.
So this is why what you're doing is so important at Hy-Vee Health Exemplar Care, is that you guys are working with people individually to create these plans for them, because people are unique, and that's really important.
Mhm.
Elli Vore, a physician assistant at Hy-Vee Health Exemplar Care. People absolutely should reach out to you if they want to do this. I just call it healthcare subscription is what I call.
Yeah.
Like bypass all the other doors, just go direct 24/7, get support from Hy-Vee Health Exemplar Care. How do people do that? How do people reach out? What's the website?
Exemplar.care is our website. We make it very easy. We've, switched our process a little bit. You can sign up for membership online. We now have our access plan, our complete plan, and our diagnostic plans. So there's a lot of information on our website about what each of those plans offers. So it just makes it very convenient for people to, basically subscribe to the healthcare that they are wanting in their life.
No mystery bills, no anything.
Yeah.
You just want to see a doctor, you just get in. You don't have to deal with it. You don't
Yeah.
get 8 bills from different entities.
No copays, no surprise bills.
Yeah, I love that.
Yeah, I can, even patients have the ability to message me in our portal system. Makes it very easy for them if they have a quick question. It doesn't require a visit coming in person. They can just send a message. We can chat, a couple messages back and forth, and that's it. Just makes it very convenient for people. Everyone lives busy lives. People travel
Sure.
a lot. So it works for a lot of people.
Elli, thank you so much for coming on the show.
Yeah, thanks for having me.